Good evening. Welcome to the 178th day of the Swasthya 365 Days project. Today we are going to talk about the diagnosis, treatment and outlook of anemia. There are various ways to diagnose anemia, but the most common way involves a blood test called a complete blood count, that's usually called a CBC. The measures a number of components including hematocrit levels, which involves comparing the volume of RBCs with the total volume of blood, hemoglobin levels, RBC count, and CBC can give an indication of overall health. It also helps the doctor to decide whether to check for the underlying conditions such as leukemia or kidney disease. If RBC, hemoglobin and hematocrit levels falls below the normal range, person is likely to have some form of anemia. However, it is possible for a healthy person's levels to fall outside the range. A CBC is not conclusive, but it will be a helpful starting point. Other tests, blood iron level and your serum ferritin level, the best indicators of body's total iron stores. Level of vitamin B12 and folate, vitamins necessary for red blood cell production. Special blood tests to detect the rare causes of anemia, such as immune attack on your red blood cells, red blood cell fragility, and detects of the enzyme hemoglobin and clotting. Reticulocyte count, bilirubin and other blood and urine tests to determine how quickly your blood cells are being made if you are having a hemolytic anemia and why your blood cells have a shorter lifespan. Only in rare cases will a doctor need to remove a sample of bone marrow to determine the cause of your anemia. Stool test for occlude blood. The test applies a chemical to a stool specimen to see if blood is present. The test is positive, it remains that blood is being lost somewhere in the gastrointestinal tract, from the mouth to the rectum. The problems like stomach ulcers, ulcerative colitis, and colon cancer can cause blood in stool. Additional tests. Based upon the results of these tests, doctors may order for additional tests such as upper GI barium enema, chest x-rays, and the CT of your abdomen. Now we are going to come to the treatment of anemia. Your treatment will depend upon your type of anemia. There are a lot of causes, so there are also many treatments available. If you have an aplastic anemia, you might need medications like blood transfusion, in which you get a blood from another person, a bone marrow transplant, in which you get a donor stem cells. If you are having a hemolytic anemia, you might need medication that will hold back your immune system. Your primary care doctor may refer to a doctor who specializes in vascular problems. If it is caused by blood loss, you might have a surgery to find and fix the bleeding. If you have an iron deficiency anemia, you'll be probably needed to take oral supplements of iron and change your diet. Sickle cell anemia includes painkillers, folic acid supplements, intermittent antibiotics or oxygen therapy. A drug called as hydroxyurea, your hydroxyurea silicose, is often prescribed to decrease the sickle cell anemia pain crisis, a complicated mechanism. The medication called voxylator or buta, which can help your blood cells to keep their proper shape. Arachivo, Silaxilum timca, can help the blood cells from sticking together and blocking the blood vessels. L-glutamine, an oral powder, Endari, can cut down the trips of the hospital for pain and also guard against a condition called as acute chest syndrome. If you are having a vitamin B12 or folate deficiency, you will be prescribed supplements. Thalassemia does not need actual treatment, but if your case is severe, you might need blood transfusion, bone marrow transplant or a surgery. Anemia caused due to iron deficiencies. If you have iron deficiency anemia, your doctor will probably recommend iron supplements that contains ferrous form of iron which your body can easily absorb. Timed release of iron supplements are not good choice of most people because iron is primarily absorbed in the upper GI tract. If you see iron supplements, remember the following cautions. Always consult your doctor before taking iron supplements. Excess iron intake can also be harmful, leads to iron toxicity. Symptoms of iron overload include fatigue, vomiting, diarrhea, headache, irritability, heart disease, joint problem, and constipation. Iron supplements, like all supplements and any medication, should be kept out of children. Iron poisoning is one of the most commonest causes of accidental poisoning in children. It can prove fatal in matter of hours. Symptoms of poisoning in a child include dizziness, confusion, nausea, vomiting, and diarrhea. Seek medical help immediately. Watch for side effects. You may need to continue taking iron supplements for 1 year. Taking iron supplements with food can help prevent common side effects, which may include nausea, diarrhea, constipation, and stomach pain. Let your doctor know if you continue to have this side effect so that he can change the doses. Watch for drug interactions. Tell your doctor if you have been treated for any other condition. For example, calcium supplements interfere with iron absorption, so it is best to take them at different times of a day. The body absorbs iron best when it is an acidic medium, so your doctor may suggest taking a half glass of orange juice or vitamin C. Now we are going to see about the daily nutritional requirements and anemia. Daily requirements of vitamins and iron vary according to sex and age. Women need more iron and folic acid than men because of iron losses during the menstrual cycle and fetal development during pregnancy and breastfeeding. During a fetal gestation life, the woman will have less folic acid levels. Less folic acid level can cause neural tube defects of the baby. Iron. According to the National Health Institute, the recommended daily iron intake of adults of ages 19 to 50 is follows. For men, it's 8 mg. For women, it is 18 mg. During pregnancy, it's 27 mg. When breastfeeding, it's 9 mg. Men and women over age of 50 require 8 mg of iron daily. A supplement may be needed if adequate level of iron can be acquired through diet alone. Good sources of dietary iron include iron fortified cereals and breads, green leafy vegetables such as drumstick leaves and spinach, pulses and beans, brown rice, white or red meats, nuts and seeds, fish, tofu, eggs, liver, dried fruits including apricots, raisins, prunes, seafood. Folate. Folate is a form of folic acid that occurs naturally in our body. Males and females over the age of 14 require 400 micrograms of dietary folate requirements, mcg per DFE per day. For women who are pregnant, breastfeeding, recommended to increase 600 mcg DFE and 500 mcg DFE per day, respectively. Examples of food rich in folate is as follows: beef liver, lentils, spinach, great northern beans, asparagus, eggs, and you can add folic acid in your diet with fortified cereals and breads. Vitamin B12. The daily adult recommendation of vitamin B12 is 2.4 mcg. Women and teens who are pregnant need 2.6 mcg per day, and who are breastfeeding needs 2.9 mcg per day. Beef liver and claims are two best resources for vitamin B12. The other good resources include fish, meat, poultry, eggs, and other dairy products. Vitamin B12 is also a supplement for those who don't get enough from their diet alone. Vegetarians suffer with vitamin B12 deficiency. Now we are going to come to an outlook and summary of anemia. The outlook of a person and anemia depends upon the cause. People can sometimes prevent or manage anemia by taking dietary measures alone. The other types of anemia are lasting, and some can be life-threatening and treatment is without treatment. If a person feels continually weak or tired, then he should see a doctor and do an anemia test. Summary. An anemia occurs when there is low number of RBCs circulating in our body. This reduces the person's oxygen levels and lead to symptoms such as fatigue, pale skin, chest pain, and breathlessness. These are over 400 types of anemias caused. Are they? The common causes are blood loss, reduced or repaired RBC production, and destruction of RBC. The most commonest type of anemia is iron deficiency anemia. It sometimes develops due to diet lacking in nutrients, Conn's disease, or use of certain medications. A doctor can use a CBC test to help detect anemia. Treatment varies depending on the type, and it may include iron or vitamin supplements, medication, blood transfusion, and bone marrow transplants. However, for some people with anemia, dietary changes can also resolve the issue. Thank you.